Hey, I'm Jim Wiedrick. Every day I'm working to transform healthcare in Southeast BC, and one of my big ideas is to have smart, informed people on for one-on-one conversations. We're looking to try and improve patient outcomes and see what we can do to help make the system work better for each and every citizen of our region. So today it gives me great pleasure to introduce James Kitch. He's a nurse practitioner who works out of the Waneta Mall in Trail. Now, James is kindly agreed to come on and share with us what it means to be a nurse practitioner. It's one of the things I get some of the biggest amount of questions about from the public. How do I get a nurse practitioner as my primary care provider? I hear that one a lot, and sometimes people are just curious to know what that means and how that's actually different than having a family doctor. Good evening, James. How are you this fine evening in February?
Hi, Jim. Thanks for having me. I'm very well, thanks.
Good, good. I love doing this nighttime recording thing. It's a little bit of contrast to some of the daytime sunlight stuff. So we'll see what feedback I get about whether people want me to record at nighttime. So let's just start with, hey, how did you get to this point in your life?
As you mentioned, I'm a nurse practitioner. I work at Waneta Primary Care. I've been a nurse many years.
The veil of mystery. Yes.
uh, uh, Really a long time. But nearly a decade ago, I went back to school and completed my master's in nursing, and that allowed me to become a nurse practitioner. And I've worked in a few spots since then. I spent some time in Arctic outposts. I've mostly been around the West Kootenays, and very, very happy to be here.
That's cool. Well, I want to hear a little bit more about that Arctic outpost, but just to set that in motion, tell me what your clinical practice is like in the year 2025. What kind of things is it full of, and how does your week, your month, or your year flow?
Oh, yeah, great. So I'm fortunate enough to work in a group practice. So I share, a birth to death primary care practice with two other nurse practitioners and a team of allied health providers. So in our clinic, we have um, physio, a social worker, a clinic nurse, an OT, and then we have access to a respiratory therapist, a pharmacist, um, and a dietitian. So I really believe that healthcare is best provided by a team. I think primary care, especially, is a really enormous subject. There's just a lot to know, and I think the more experts that we bring into that, the better outcomes for patients. So our clinic is set up so that patients can access the right provider at the right time to maximize their health. So, like nurse practitioners anchor the team to a degree. We're the primary care providers, but patients can book directly with any of the clinic services without seeing the NP, or they can come and see us and we can direct them to the right service. And that works well for a lot of patients, I think.
I'd love to hear it. That's great. I mean, one of the things that I think is gaining some momentum over the last year is a push towards having primary care provision be delivered by team-based outfits. And, I know I've quoted before that Jane Philpott, who once upon a time was the federal health minister, has recently just written a book, and that was her principal point was we need team-based care and provided in all the different geographical locations. Yeah, you're
Yeah, I really think so. I think it improves patient outcomes. It reduces waiting times. It reduces the need, honestly, for escalating care in a lot of situations. You know, for example, if someone comes in with knee pain, they've got some arthritis, they've worn their knees pretty hard, instead of immediately flicking them to a orthopedic surgeon, we can encourage them to do some physio for the next few months, and often that's enough to avoid surgical intervention. So it's just the right provider at the right time equals better patient outcomes.
Maybe spend a minute and give me the 30,000-foot flyover on how a nurse practitioner is different from a nurse, and also how a nurse practitioner may or may not be different from a family physician. What's your take on the compare and contrast in those two neighborhoods?
Yeah. Okay. Thanks for that question. So nurses are an essential part of healthcare teams, and they provide, relational care for patients, and they're an essential role in our healthcare ecology. But they don't backstop the care generally, right? So if you're a particularly motivated nurse or a glutton for punishment, or you really just don't want to sleep well at night, you can go back to school after getting your degree and you can become a nurse practitioner. And that really broadens your scope. So nurse practitioners all started life as nurses. To work as a nurse practitioner in BC, you need a master's degree or a doctorate in primary healthcare, or a specialty nursing subject. So generally in primary healthcare. And this enables nurse practitioners to work with a scope that's very similar to those of doctors. So everything that your primary care doctor does, nurse practitioners also do. So that's the main similarity. The difference between nurse practitioners and physicians is that our training is a little bit different, right? So physicians go to med school, and that's a valid use of their time. Nurse practitioners go to nursing school and get a master's. So the training time is the same. We have like 6 years of schooling, but the focus nurse practitioners during their initial schooling is much more kind of relational, and I hazard to say like a little more holistic in their outlook, right? So our training is not really separated into like biophysical systems. So we don't spend a long time doing residencies in orthopedics or ENT, but we spend most of our time looking at patients as whole beings and trying to focus on their their wider health and their context in the community.
Thank you for that overview. I mean, I've been on frankly, a journey of understanding maybe the nuances of the nurse practitioner role over the last decade, because truthfully, up until about 2014, 2015, I didn't have clinical links or clinical parallels with any in the workplaces and the workspaces that I was in. And I remember famously that I think Adrian Dix had given a speech once, and he said something to the effect of, nurse practitioners provide better care. And I think predictably there was like, oh, how dare you slag other people, And yet I'm like, oh, let's all get older and wiser. Do we have to find troubles in every sentence? Because I think what he was trying to get at, and I'm leading up to ask you what you think, was that effectively, for the needs of many patients in that primary care setting, nurse practitioners were giving a very quality experience, and they were leading into a higher sense of client or patient satisfaction. At least that was my perception, was what he was going for. So, comments, thoughts?
Yeah, of course I'm biased. I know that we give excellent care for sure, and I know many physicians also give wonderful care. I think there's slightly different tensions with nurse practitioner care and physician care, and I don't think that comes from the care that we deliver, but I think it comes from the context of our employment. So nurse practitioners are generally salaried or contract based. And physicians are far more commonly fee-for-service based, which sets them up with a requirement to see a number of patients per day, right? Because, you have families to support, mortgages to pay. And so like many of my physician colleagues choose to have shorter visits so they can see more patients, so whatever. Whereas nurse practitioners have the luxury of a little bit more time to spend with patients. Not every patient needs a lot of time, but because we're salaried, if you need a longer visit, then we're well equipped to be able to provide that without hustling you out the door after 10 minutes. I encourage my patients to bring their lists and we'll work through them. And ideally, that means they can see me less often and we can see more patients. But that doesn't always work out. But I think that's one of the biggest differences. I think nurse practitioners provide better care. I think we provide, individualized care where we can.
Thank you for such a diplomatic answer. That's excellent. Hey, so talk to me a little bit about the difference, because you foreshadowed that you've spent some time in more remote communities in the Arctic. What's the difference in providing care in southeastern BC, so in your case the Kootenays, to Northwest Territories, Nunavut, any of those locations? What as you reflect back were the big, most striking contrasts?
Oh, yeah, it was certainly an access situation, Jim. I mean, I think when you look at the care provided by primary care providers or NPs in the lower mainland, their scope is very narrow because there is a wealth of specialists that they can refer to, right? And I think the further you get from urban centres, the broader your scope becomes out of necessity. So, for example, working in trail, there's a number of specialties that we don't have. So I think nurse practitioners and physicians all have to broaden their scope a little bit more and be a bit more comfortable treating a wider range of ailments. And when you move even more remotely, then you're perhaps the only provider for hundreds of miles, and so your scope is suddenly enormous. I'm fortunate enough to have spent lots of time in the Arctic, and it's always been experiences that I've enjoyed, but they can be pretty challenging. So I'm delighted to find kind of the middle ground between the absolute dearth of services are available in the Arctic and, the enormous wealth of services in larger urban centres. I think in the Kootenays, there's plenty of challenges for primary care providers and enough to keep everything interesting. And
one of my sometimes I lapse into story time with Jim, but one of my favorite stories of time in the Arctic, because I've spent like 6 or 8 weeks working up there, was like a Saturday afternoon in Inuvik, and there was a lady having her third baby in Tuktoyaktuk, and they all decided that they couldn't fly her to Inuvik. There would be too much risk of having the baby in the air, so they needed to fly a doctor to her. And so one of my colleagues and I played rock, paper, scissors, and I got to fly to Tuktoyaktuk and deliver a baby with the help of some paramedics and a nurse practitioner or two. And, it was one of those ladies who had an easy time giving birth, and it was a third child, and there were no complications, thankfully, and it all went swimmingly, and I got a free plane flight. But what if it hadn't? I mean, I don't know. So
That,
it's always that dynamic. I would have been the doctor in Tuktoyaktuk, no hospital, but anyway, the story ended well. So yeah,
yes. I mean, I think every situation becomes, much more tense when it's just you. So you've got to be, really prepared for the worst, and hopefully it doesn't happen.
yep. Bring as much experience and heart and compassion to it as you can, and off you go. Yes.
Absolutely.
So I'm going to anoint you a really, really important and powerful person. And I'm going to say, James, there's a lot of things that aren't so good with our healthcare system these days. What are you going to do to fix it in, say, the short and medium term? And if you want, you can even lapse into going really long term. But I'm thinking you've got 1 to 5 years. How would you set in motion any big ideas you have that you think we'd all benefit from?
Oh, sure. So that's a great question. I think certainly more primary care teams will make a big difference. And spreading those primary care teams equitably about about the region would provide access for everybody. I think more regional services will make a difference. So virtual primary care teams can deal with lots of ailments. Not everyone needs to be physically seen, and it actually changes the dynamic of a visit quite favorably to be able to provide virtual care for people. People are a lot more comfortable in their house seeing a provider than they are in the office. Right? It doesn't make anyone happy to come in and see me and tell me about their lives. Sometimes, so I think that makes a big difference. Of course, increasing the number of providers, be it primary care physicians or nurse practitioners, uh, will make a difference. And I think, changing the way that nurse practitioners and physicians are paid will make a difference. So,
I've seen some impetus since the end of the pandemic to, really embrace things like virtual care, because that was practically unheard of in 2019. But I still see that, there's that inertia and that, I don't know, that would be different. That probably we just have to jump into embrace the potential benefits of some change, because I really don't think the status quo is where it's at anymore.
well, I don't, I think there's many good things about our current system, but there certainly are problems. And it seems, however much money is thrown at the current system, patient attachment doesn't seem to increase very much, and patient access also not great. There's just such a high rate of attrition amongst primary care providers that it's difficult to wrestle the attachment and access problem to the ground with our current framework. So I think, moving away from patient attachment to a particular clinic and towards patient attachment to an area, similarly to the way that kids are attached to a school area. So, when you move to Nelson, you don't attach your kids to a particular school. They're attached to a school district. And so if patients were able to see any provider in that district, that would really improve access and really improve attachment. To get to that point, we need solid functioning teams. We need good interprofessional communication, and we need electronic medical records that all talk to each other. So that would be a great place to start.
You touched on that EMR, electronic medical record issue. It's such a trouble spot. I wonder how that all evolved. I don't think I've tracked all the different threads as to how one health authority started here, and then another health authority had a different EMR, and each clinic got to choose its own, and then we finally got reasonable local EMRs, but then they can't talk to each other. Oy, 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 oy.
It's exasperating. I mean, fortunately now at least there is a provincial system which allows you to access some records from around the province. So if patients move about, you can get consult notes from the coast or, lab results from Prince George. And that's great. But in general, the different electronic medical records don't talk to each other, which is an enormous oversight because it leads to real black spots in patient care. Um, particularly if patients move communities, then often their health records, if they take a long time to find a new provider, then their health records very difficult to track down comprehensively, right? But if we shared a health record between clinics, then I do think patient outcomes would improve, patient access would improve, and really, like administration tasks decrease. The whole system would get like a little bit more lubricated, a little bit better oil.
Thank you. So, without necessarily getting into exact specific numbers, in your clinic, because you mentioned it was a team of 3 nurse practitioners, and then you did a comprehensive job of explaining all the other practitioners who are associated or aligned with you. What does it take to become a patient of that clinic? Do you have to apply? Do you have to enroll? Do you have to wait until there's an open space? Like, I think even and I work in the system, I don't even know what the exact process is for that. Is it just, hi, it's Jim, when can I come in? Or is it more formal than that? I don't know.
Yeah, I mean, we each have a panel of patients. Each nurse practitioner has a panel of patients. The target for rural MPs is between 900 and 1,000 patients. We're each pretty full, but it is a group practice. We cover each other's patients. We accept patients from the Health Connect registry, which is, the list of unattached patients. It's now a provincial list. We had a very robust local list. So we accept patients from there. We also accept patients from KB Health Online, which is a virtual clinic which is run to support high-need unattached patients. And so if they urgently need a provider, then we're happy to accept those patients. We also accept patients from local midwife and maternity practices because young families often need providers, and like, what kind of monster would you have to be to not accept babies, right? So those are our 3 main things. Sadly, we don't have the capacity to accept walk-in patients at the moment. I'd like to see that as part of our future plans, but we're not where we can do that.
Yeah, there has to be some kind of guardrail set up so that you can run an efficient ship. So no, you did a great job of explaining that. Thanks, James. Do you see a significant growth in the number of nurse practitioners in the province of British Columbia in the next 5 years? Have you either heard, seen projections, or do you understand what the nurse practitioner power statistics will be? The number of people who are serving as nurse practitioners in our province is what I mean.
Yeah, for sure. So I'm not sure of the exact number at the moment. I think we're around 1,000. The numbers are not huge. Like, the numbers of NPs within the community boundary has really expanded over the last, 5 to 10 years. So that's been great. There's 4 universities that offer NP courses at the moment. They have each expanded their enrollment to, between 30 and 40 seats and intakes. So, roughly speaking, that's 160 new nurse practitioners a year. At the moment, there are so many nurse practitioner jobs in BC that really every NP could work two of them. So, there's a lot of opportunities for NPs, not just in primary care, but throughout acute care settings. There's NP hospitalists and NP specialists all over the joint, and they're well utilized and they're effective healthcare providers.
James, I can't thank you enough for a really interesting interview. You did a great job of giving us an overview of what it's like to be a NP, what it all entails, and how the system is gliding. And I am absolutely with you. I hope that we can make significant progress in the next little while with primary care teams just across the province and regions everywhere, and that all those teams can hopefully involve an element of the nurse practitioner role, because I see how valuable it is. Thank you.
Well, thanks for having me, Jim.
Cheers.